Infusion pharmacy is pretty much outpatient ambulatory service. So patients, once they're diagnosed and they start cancer treatment, they come to one of our facilities to receive that treatment. And that is associated with scheduling component where they see their providers in clinic to discuss the regimens that they'll be started on, the cycle duration, and ultimately with that feedback with their provider, they're connected to the infusion center so that they can receive their treatment. And so our nurses, our pharmacists, our APPs, clinical pharmacy specialists, pretty much an interdisciplinary team that's within the infusion center to make sure that the patient's on the right regimen, they meet the treatment parameters and the labs that they need to proceed with treatment, and ultimately pharmacy making sure we dose patient correctly for the medication needs. When I think of where science becomes hope, I think of what we're doing as an organization, being involved in research, taking on clinical trials, seeing what works for our patient, what doesn't work for our patients, so that we can ultimately make the best decisions for what treatment cares we're going to provide within our facilities. Being on top of newest innovative data, drugs that are coming out, or maybe medical devices that we can implement to make work more efficient for our teams. And so we're actually using the technology and the resources that are available to us to further optimize the care for our patients and reduce the cancer burden that we're starting to see, and especially in the younger population. So I think as we tap into additional screening access through clinics in our outpatient facilities, we can probably identify cancers or tumors at an earlier stage so that we can ultimately provide the best treatment so that individuals can actually ring that bell and say that they've completed their therapy and ultimately become survivors. What inspires hope for me? I've had quite a few employees that have been diagnosed and have gone through treatment and overcome it. I think that right there gives me hope because I know that there are treatment options there and that cancer is no longer end of life statement, that we do have options out there. And the most important thing that I've realized is the community and how important it is to have a community when you're going through that. And so being involved in that journey with them continues to inspire me and only confirms that I'm in the right area, in the right field, and doing the right things ultimately for our patients. And I think when we bring that back to individuals, like that medication that you're holding in your hands is saving a life, it just makes you look at it from a different perspective and gives you continuous hope that there is a light at the end of the tunnel.